In the last 24 hours, we have identified 477 new cases of COVID-19, while our lab conducted more than 12,000 tests. More than 21,800 people have now recovered from COVID-19. Currently, 130 people are in hospital in Alberta, including 18 in intensive care. We continue to monitor hospital capacity very closely. In the Edmonton zone, the impact of COVID cases is still causing elective surgeries to be postponed. The need to protect our health system from being overwhelmed is one of the reasons that we announced new mandatory measures for the cities of Edmonton and Calgary on Monday, and why we all need to do everything possible to limit the spread. Sadly, I must also report 5 new deaths in Alberta. Every death caused by COVID-19 or by something else is a terrible loss for those who loved that person. I want to express my heartfelt condolences to everyone who has lost a loved one to COVID or any other cause during this difficult time. As of today, AHS has confirmed that students and staff at 153 schools that previously had alerts are now back in class and off the list. There are active alerts or outbreaks in 249 schools, which is about 10% of all the schools in the province. Currently, these schools have 730 active cases in total. This number includes 111 schools that are on outbreaks, including 45 currently on the watch list. So far, in-school transmission has likely occurred in 87 schools. Of these, 48 have seen only 1 new case occur as a result. As I have mentioned, we must strike a difficult but necessary balance in responding to COVID-19. We must follow the evidence and take the steps needed to prevent cases from rising exponentially and overwhelming our health system. At the same time, every element of Albertans' health is important. We must also limit the harms that our measures can have as much as possible. This means we must be nimble and avoid either-or approaches. The choice is not between implementing another lockdown or letting COVID-19 run unimpeded. Instead, we must make it as easy and safe as possible for Albertans to live with this virus for the foreseeable future. This means implementing targeted measures when needed, such as the 15-person limit on social gatherings announced on Monday. But it also means using our own evidence and learnings from other jurisdictions to relax other measures that are not adding value when we can safely do so. On Monday, I said that we were reviewing the symptom list for school-aged children. I am pleased to say that our work is now complete. Thank you to all the parents who have been using the checklist every day to assess if their children are well or have symptoms of COVID-19. I know this can sometimes feel like a tedious process, but it is an important part of our regular routines to keep our children, their classmates, and their teachers healthy. When we developed the symptoms checklist, we did so with the utmost of caution, with the information available at the time, and with an intent to prevent widespread transmission in schools. As with all of our public health measures, we developed the list knowing that we would revise our approach if needed, based on new evidence and learnings from other jurisdictions. That is why, starting Monday, we will be implementing a new symptom list for all Albertans under the age of 18. This includes the daily checklist used for students in school and in all childcare settings in the province. We are making 2 significant changes that will help get those under 18 back into childcare or the classroom as quickly and safely as possible while minimizing the risk of COVID-19. The first change is that we are removing runny nose and sore throat from the list of symptoms that require mandatory isolation for children. In the last week alone, more than 3,400 children and youth were tested for COVID and reported having a sore throat. Of those, just a little over 700 had a sore throat as their only symptom. Less than 1% of those tests were positive. Similarly, more than 3,300 children were tested with a runny nose. with only 601 of whom having a runny nose and nothing else. Less than 0.5% of those tested positive for COVID-19. This shows us that these symptoms by themselves are very poor indicators of whether a child has the virus. Based on our data so far, the risk that a child with just one of these symptoms has COVID is even lower if that child is not known to be a close contact of someone with COVID-19. I want to be clear that this change is only for those who have not had a known exposure. If a child has had close contact with a COVID case in the last 14 days, then a runny nose or sore throat is still enough to recommend testing, and they would still need to continue to stay at home in self-isolation. The second change that we are making is to shift towards a more targeted checklist, one that takes into account the total number of symptoms that a child may have. Any child who has even one of the core isolation symptoms, which are cough, fever, shortness of breath, and a new core isolation symptom of loss of taste or smell, must still isolate for 10 days or have a negative test result and resolved symptoms before resuming activities. That is not changing. However, for all other COVID-19 symptoms, we are shifting to a more strategic approach. Starting on Monday, if a child has only one of any of the other symptoms on the list, they should stay home and monitor for 24 hours. If their symptom is improving after 24 hours, testing is not necessary and they can return to normal activities when they feel well enough. However, if the child has 2 or more symptoms on the list, then testing is recommended and they should stay home until the symptoms go away or they test negative for COVID-19. To use a practical example, if a child has just a headache, they should stay home for the day, and if things improve, they can return to school as soon as they're feeling able to do so. But if they have a headache and a runny nose, then they should stay home and either get tested or stay home until the symptoms go away completely. Once again, we are acting on the evidence, which shows that any one of these symptoms individually is a poor indicator that a child has COVID-19. However, 2 or more symptoms increases the risk, and so changes the approach that we need to take. Today's changes align with similar ones made in BC, Ontario, and Quebec. We have watched these jurisdictions carefully. After they updated their lists, they did not see a corresponding increase in COVID-19 transmission in schools. I believe this is a step forward for children, parents, teachers, and childcare operators,